Cornwall Care originated as traditional residential accommodation coming away from the local authority in 1996. 18 homes spanning the width and breadth, length of Cornwall and employing around 1,100 staff. The shape of Cornwall has dictated that we do have homes in most of the towns, major towns in Cornwall. That being said, I think we've actually tried to encourage the local population to embrace the home in their town, and that's very much being part of Cornwall Care. Each home is a community within a community. There's been one really major plan, and that is that older people will be cared for in really beautiful environments with beautiful care. When you have beautiful views and natural light and areas to walk quite freely and outside space where people can be able to enjoy the outside, which many people who've lived in Cornwall, that's what Cornwall means to them. So we built Cedar Grange very much thinking about what would our clients really want and what would make working with our clients in that building an absolute joy, and Cedar Grange is the result. Rurality does mean something quite different to urban models of care, so I think it's essential that people go out and ask the older population what is it that they want. Often with health and social care policy, it seems that it's an urban model that we're asked to accommodate, and really with this rural area we do have to adapt and amend urban models. We're great at innovation in Cornwall, but it would be wonderful to be at the table during the design stage, because we could save a lot of time and I think probably save an awful lot of resources if we were actually planning. Working in a rural area, you have to be thinking about sustainability right at the beginning, at the inception of any work. It's all very well having a strategy and we can all make things happen, but actually making it stay there so it's bedded in and actually of value to the community years and years later, that's the really hard thing. And I think that's what Cornwall Care has managed to do. And it's done that by listening to its staff and listening to its clients. And what we've tried to do is actually create a career pathway so people have a career for life. So if there are young people who live in the rural areas, their options of employment are quite narrow in Cornwall. Many go to university and seek employment outside of the county. What we're saying to people is that's a wonderful option, but if you want to stay in Cornwall, your options could be a career in care. And I think that actually says to people, you can live in the rural area, you can stay in your community, you can be part of giving something back to your community, and actually you can feel just a tremendous sense of satisfaction. We're most proud of the care that we deliver, the emotional connection in that care. I personally am very proud of seeing the compassion and the tenderness of the care delivered on a daily basis. Really, our endeavour is to ensure that we in Cornwall Care can deliver beautiful care wherever it's required, and hopefully in partnership with the public statutory organisations. And really, we should be the flagship with regards to rural communities in England.